Have you ever heard of a silent heart attack? It's called silent because it strikes quietly, with symptoms so subtle that most people completely miss them. No dramatic chest pain, no collapsing moments like in the movies, just small signs that we often ignore. And yet, this silent killer is responsible for thousands of preventable deaths every year. In today's video, I'll show you exactly what those early warning signs look like, who's at the highest risk, and what you can do today to protect yourself or someone you love from a heart attack you never even see coming. The heart is a remarkable organ. It beats over 100,000 times a day, pumping life through every cell in your body. But just like any machine, it needs clean fuel, clear arteries, and consistent care. The problem is when blockages start forming inside your arteries, your body doesn't always shout for help. Sometimes it whispers. And those whispers are what doctors call silent heart attack warning signs. A silent heart attack happens when blood flow to a part of the heart is temporarily blocked, just like in a regular heart attack. But the signs are mild or mistaken for something else. You might think it's fatigue, or heartburn, or just stress. But inside, your heart muscle is actually being damaged. And here's the dangerous part. People who experience one silent heart attack are 3 times more likely to have another, more severe one later. So, understanding the signs early can literally be the difference between life and death. Let's break them down clearly. 1, unusual fatigue. Feeling tired for no clear reason, especially after mild activity, is one of the earliest signs. Your heart might not be pumping enough oxygen-rich blood, making even simple tasks feel exhausting. 2, shortness of breath. If you find yourself winded while climbing stairs, walking, or even lying down, it could indicate your heart is struggling to circulate blood efficiently. 3, mild chest or jaw discomfort. Not every heart attack comes with crushing pain. Sometimes it's just a dull pressure, a tightness in your chest, or a strange ache in your jaw or neck. 4, pain in arm, back, or upper stomach. This one surprises people. Pain that seems to move from the chest to the arm or upper back can be a major red flag. Your brain sometimes misreads the pain signals coming from the heart, a phenomenon called referred pain. 5, nausea, dizziness, or cold sweats. If you suddenly feel lightheaded or break into a cold sweat, even without exertion, that's your nervous system responding to reduce blood flow to the heart. 6, indigestion or heartburn that feels different. Some people, especially women, mistake heart pain for stomach trouble. If the discomfort feels deeper, heavier, or doesn't go away with usual remedies, get it checked immediately. While anyone can have a silent heart attack, certain groups are much more vulnerable. People with diabetes, because nerve damage can dull pain sensations. Smokers, due to long-term artery damage. Those with high blood pressure or cholesterol, which slowly narrows arteries. Women, especially after menopause, when protective estrogen levels drop. People with family history of heart disease. If you fall into any of these categories, your body's warning system might not work as strongly, making silent symptoms even easier to miss. Here's what you should do immediately. Stop what you're doing and sit down. Don't try to tough it out. Call emergency help right away, even if the symptoms seem mild. Minutes matter when it comes to heart muscle damage. Take an aspirin if advised by your doctor. It helps reduce blood clotting. Stay calm and still until medical help arrives. Stress and movement can worsen oxygen demand on the heart. Once you're stable, your doctor will likely recommend an ECG, blood test, or echocardiogram to check for heart damage. The best way to deal with a heart attack is to prevent it altogether. Start by Eating heart-healthy foods, olive oil, fatty fish, nuts, leafy greens, and vitamin K2-rich foods, exercising regularly, even a 30-minute walk improves circulation and strengthens your heart muscle. Quitting smoking. Every cigarette damages your arteries. Managing stress through meditation or deep breathing. Getting regular checkups, especially if you have risk factors. Your heart gives you subtle signs long before a crisis happens. You just need to learn to listen. Remember, a silent heart attack isn't truly silent. Your body always speaks. It's up to you to recognize what it's trying to say. If this video helped you understand your heart better, share it with someone you love, because this simple knowledge could one day save a life, maybe even your own.